KNEB and News Extra Time, brought to you by First State Bank. Here's Kevin Mooney.
Thank you, Dennis, and good morning, everyone. Our guest today is Dr. Lisa Scheppers. She is the medical director at Regional West Medical Center for the Hospitalist program, and we'll have her kind of describe that here initially in our conversation with her. What is the Hospitalist program? Because unless people have been in the hospital, they probably don't realize this program is going on.
Yeah, about October 2009, we started a program where the hospitalist will take care of patients that are just in the hospital. And so we allow the other physicians to manage the clinic patients. And from the time that the patient is admitted to the hospital to the time we discharge the patient, we manage all of their care during that time. We're able to really concentrate on those hospitalized patients and provide their full level of care they need.
All right, so this is kind of like having a doctor in the hospital, pretty much, situation where you don't have to really worry about contacting with your own physician. You can have somebody in there that takes care of the situation. How do the doctors like this?
Most of the physicians that we work with really enjoy our program. They're able to concentrate in the clinic. We notify them in multiple different ways that their patient's been admitted to the hospital, and then we're able to provide them a good detailed summary at the end of the hospital stay of everything that we did, everything that was taken care of, and what still needed to be followed up on. So we're able to give them good communication during the whole stay.
Now you guys have not just a few hospitalists right now, but you have over half a dozen.
We've continued to expand the program, so we're up to 7 physicians at this time and 1 nurse practitioner that works with us on a routine basis. So we're continuing to expand, and there's more providers that would like us to cover their services. So we're continuing to look for new providers to come in, and we're hoping to expand by the end of the summer or early fall.
Yeah, maybe another couple, possibly.
Yes, we're hoping to bring in at least a couple more physicians. So.
All right. Now, as director of this program, your job is to kind of basically schedule some of these hospitalists, make sure everything's going correctly. Kind of describe what you do.
As the director of the program, I not only work the same number of shifts. We all have different shifts that we work, covering during the day and in the evening. And then as the director of the program, I help to make sure the things are running smoothly behind the scenes, helping schedule, doing the relations with other physicians, and working on expanding the program continually. So,
you work with the nurses. I imagine that the staff at the hospital thinks this is a pretty good idea because it allows the nurses to do what they're trained to do rather than try to be a doctor in certain situations, right?
I think that we're great for the nurses. I've always heard some good comments back from the nurses. We're able to answer our phones easily and really available to be on the floor, spending more time with the patients, easily accessible. We don't have to wait till the end of clinic to go in and see the patients after work, or we can respond to emergencies very quickly. And there's a smaller number of us during the day, so we may have multiple of their patients. They can talk about multiple patients at the same time. So we've been able to work well with the nurses during this time.
All right. All right, let's take a break, and we'll be right back with Dr. Scheppers.
Mama, Granny, you will never guess what your son-in-law did now.
Medicine physicians.
Oh, no.
Yeah.
But you cover the
I
primary.
was looking for a canceled check and discovered that Kenny is so paranoid about identity theft that he ran every piece of paper in the house through the wood chipper.
You need e-statements
cover all
from
the
First State
unassigned
Bank.
patients.
Always
We
have
cover
fast and secure
Yeah.
access to your statements, and Kenny won't have to worry
From out
about
of
your bank
town.
statements being in the mail or lying around.
Thanks, Mobile Granny.
First State Bank, member FDIC.
We are back on the News Extra program today. We're talking to Dr. Lisa Scheppers. She is the medical director for Regional West Medical Center's Hospitalist program. And this program, Dr. Scheppers, began just a couple of years ago, right?
October 2009, Dr. Doris Purvis was here. She was able to help get the program started and off the ground, and we've just continued to grow from that time. So.
And nationwide, this is a program that started maybe 15 years ago, something like that?
Yeah, it was first termed the Hospitalist program back in 1996. Just a movement of internal medicine physicians that were working in the hospital only and became more entrenched in the hospital system, managing those sicker patients that are in the hospital. And they developed the hospitalist movement, and it's continued to grow. nationwide over the last 15 years or so.
And these are all internal medicine physicians that are at the hospital doing this.
Here at Regional West, all of our physicians on the program are internal medicine physicians. So we specialize in the treatment of adults, so 18 and older, and we do all in-depth care for those adult patients. We don't do kids and we don't do OB. So.
All right. Do you ever have any patients that say, gee, I'd really like to just talk to my own family physician and not necessarily to another physician to manage my care, and how do you work around that?
We do have that happen fairly frequently. We cover a lot of the family practice physicians in town, and usually our discussion is centered around the fact that we're here to work for them. We're going to keep in good contact with their primary care provider, but if there's really an issue, we're happy to call those physicians. We're happy to keep them involved in the care. I do that on a routine basis if I need to have that physician involved with the care, and then we always get them back into the clinic with their regular doctor at the end of the stay.
Yeah, so there is a lot of communication with their own physician.
Exactly, and that's what's most important in success of the program is that communication.
Yeah. When we're looking at this situation, let's go over your background a little bit. You're a local person.
I actually
graduated from Gary.
Yes.
We're not going to say when.
No,
we're not going to say when you did. But she's younger than most of the people in this room, so matter of fact, all of the people in this room, I think.
Well, thank you.
So you're doing quite well, and so you're in the community a lot, and like we said, how have the patients accepted this? Is it a well accepted program right now?
Yeah, at this time, actually, most patients really enjoy that. I think we can give a very dedicated service. We're not divided between going to multiple different places, and we have somebody always available. We have 2 physicians and a nurse practitioner that work most of the days, and so we have multiple providers caring for them, and then we always have somebody scheduled for every night. So we always have a physician available to take care of people at any time and can really provide a dedicated service. So they really enjoy it.
All right, and this is, I would imagine, all part of the recruitment program that Dr. Sorensen has for the hospital, right?
Yes, as we're able to provide some of that hospital care, we're able to bring in more subspecialists because they can make sure we have somebody to manage those patients at all times.
Okay, now do you guys work, right now you're working with a lot of family practice physicians and a number of other physicians. Not everybody has you working their patients at the present time, right?
Correct. At this time, we cover at least of the 8 RWPC family practice doctors, and we cover for one of the internal medicine physicians. We cover many of the other physicians in town. We cover for the surgeons and other providers that have outreach and bring their patients into the hospital and maybe don't have a local provider. We provide consultative services to those doctors while they're in the hospital. And there's many patients that actually don't have a doctor around town, and if they come to the hospital, we're there to take care of them also.
All right. Very good. Well, it's a great program.
Thank you very much.
And obviously, well, I mean, when people are in the hospital anymore, they're pretty sick, aren't they? I mean, with all the outpatient situation that's now in medical care, I mean, if they're in the hospital, they're pretty sick.
Absolutely. It's definitely changed over the last 10 years even. The patients are sicker, they require more care, and the insurance company, we need to say, they need to be here in order to keep them in the hospital. So they're sick, and we're able to provide that dedicated care.
All right, very good. Well, thanks for stopping in and explaining the program.
Absolutely. Thank you for having me.
And it's good to have a local running it.
All right. Thank you.
Thank you.